It's still morning. Good morning, all. As he said, my name is Esther Mongi. I'm working with World Vision Tanzania as a Gender and Advocacy. My presentation will focus on nutrition-based advocacy to children under 5. And the case study will be in Reach Project, where is operating in Singida and Shinyanga. Because I'm working with World Vision, so I'll share our definition of what is advocacy according to World Vision. And I'll share in brief our CVA approach. CVA is Citizen Voice and Action, and is a local level advocacy approach. And then I will explain in brief why are we doing advocacy specific on nutrition to children under 5 in our community. We'll share some results, the challenges, the lesson learned, and some recommendation in the way we are implementing our CVA approach. But at the end, I will welcome Muivano and to share with us a practical experience of CVA from 2 regions. So I can welcome Muivano to come. What is advocacy according to World Vision definition? And when I'm talking about World Vision definition, this definition you'll find in World Vision Kenya, Uganda, in all the countries where we are operating. Advocacy is a project, can be a project or a program or programmatic approach which seek to address the structure and systematic causes of poverty by changing the policies, by changing the system, by changing the practice and attitude that perpetuate inequality and deny justice and human rights. We heard from my brother Makalios a list of issues related to nutrition, whereby we need to work together in the community so that the mindset, my mindset and your mindset can change. And those issues is just a few of them which are in our community. So he touched a little bit of attitude in advocacy, in what we are doing in advocacy. So we still have to do something on policy change. We still have to do something on the system we are working with and the practice of the people we are working with in the community. But we are doing our advocacy in 2 levels. In our programming, we must focus on policy influencing and citizen empowerment. When we are talking about policy influencing, we are touching 2 areas. The first one is policy implementation, because we know that at the national level, we have very good policies, we have a very good national guideline, and very good plans of action. But are community aware of those national policies? Are the community aware of those guidelines? Are the community aware of those plans in relation to nutrition or health? So in whatever we are doing in our community, in our program related to nutrition or related to health, we must ensure that the community are aware of those policies and work together with the government to ensure enforcement of those policies. While implementing a certain policy, it can be on health or can be on nutrition, is where you can able to identify the gaps existing on that policy. You can't say that this policy is not working if you are not yet implement at the community. When you find a gap on those policies is where, as World Vision, we work with other stakeholders, like-minded organizations, to make sure that the policy is reviewed or that policy will produce another policy which needs to be developed at the national level. Another component we are working with is on citizen empowerment. From day one, we have been speaking about nutrition, we have been speaking about Amaranth grain, but do the community aware on the importance of Amaranth grain? Are they aware on their rights and their responsibility? So as World Vision, is our role to ensure that the community are aware on their rights and responsibility so that they can engage well in whatever they need to do so. But after being aware of the right and responsibility is where a person can have a self-confidence and have a community mobilization so that they can mobilize together and speak for their own voice to speak about a certain issue. So in whatever we are doing, we must focus on the policy influencing and ensure that community are well empowered, aware, and they can mobilize themselves. So when we are talking about CVA, is our local level advocacy approach. As I said, CVA is Citizen Voice and Action. And when we are talking about Citizen Voice and Action, it's a social accountability approach that facilitates dialogue between service provider, service users, and the government. In World Vision, we are not doing advocacy as an activism. We are doing it through dialogue, lobbying, and working with other organizations. We are not attacking the government that we are not doing 1, 2, 3, but we always sit together with government and other stakeholders and plan together and see what we can do together to come up with those issues. So, as I'm saying that through CVA, we always facilitate dialogue. We know that there is a very big gap between the service providers and users and government. So through this CVA approach, we can able to connect them together so that they can sit together and see what are the issues, what are they supposed to do, what are the issues, and they can come up with a plan of action so that they can solve that issue which is ahead of them. And when we are talking about CVA, there is a 3 phases of the CVA. The first one is to create an enabling environment, enabling citizen engagement. It's not possible for a citizen to start to engage if they are not aware of what they need to engage for. So the first one is to ensure that we are working with the government to ensure that there is a simplified policies whereby a citizen and a community can be aware of. And when we are talking about nutrition, what are they supposed to do on nutrition? When we are talking about health, what are they supposed to do on health? For example, I can take a simple example. We have a dispensary in our community. Do the community aware, when you are talking about the dispensary, what is supposed to be in a dispensary? For this building to be called a dispensary, what is a dispensary? For that awareness can help them to understand the quality of the dispensary. And from there, they can sit down and analyze. In our village, we have a dispensary. The standard to be, the monitoring standard for a dispensary is this: how many health workers is supposed to be there, the equipment is supposed to be there, everything building to be called a dispensary. They can sit together and start analyzing, is our dispensary qualified to be called a dispensary? After doing that analysis and sitting together, brainstorming between the service providers and users, from there they can identify the gaps. So what are we going to do together so that we can fill the gap which is missing? For this school to be a school in one room, how many students are they supposed to be in one room? How many teachers are they supposed to teach in one room? How many books for one student? You can't say that this room has many students if you are not aware of the number of students is supposed to be in one room. So after that awareness that they know, I need to monitor on this according to the national guideline and national policy, is where they can identify the gaps and come up with a solution together on how to address those gaps. So the first one is to ensure that community are aware on those monitoring standards, and we always work with the community so that the first thing is to have a CVA team at the community level and raise awareness, raise an awareness so to train those CVA team. And the person who is supposed to train those CVA team are technical person from the district. If it's a nutritional person from the district, is the one who will train the CVA team on the monitoring standard. So the second phase is whereby the community are aware on those monitoring standards. Every standard which is stipulated on the government policies can be on health or can be on nutrition. And in this stage, we engage the community through community gathering. After being aware, we have this, which is called the monitoring standards, whereby you write on the flip chart the standard which is stipulated by the government. You analyze in my area what is the real situation. And after seeing that, after realizing the real situation, and then you come up with a solution. But also, there is a scorecard whereby the community can measure the performance either on health or on nutrition. After that, I can say that when you are talking about community gathering, is the groups of people who will be sitting in a different angle. Children will sit together with their fellow children, women's together, men's together, discussing about the certain issue. After sitting in a different groups, whereby the views of children, the views of women, men, and leaders, they can prioritize issues to focus on. On the interfaith meeting is where all the groups will come together and prioritize the issue and together prepare a plan of action. After having a plan of action, this plan of action is to include service providers and users, what the government will do, what the community will do to come up with that solution. But at the end of the day, if you want to see change and improvement of the social services, you must monitor. You must ensure that the plan of action is well monitored. And on CVA, we are saying that at the end of the day, whatever we will be doing in our community, we'll see if the social services are improved. Social services in nutrition, social services in health. Okay, so the goal, as I said, is to improve the accessibility and equality of the public or social services. But why are we talking about CVA? As I say that, it's a dialogue between the whole process. We put together the users and providers and government. So that process is a component of empowering and ensuring that citizens are well engaged and mobilized. But it's create a platform for citizens to participate on different issues, and they are free to speak about different issues on their specific groups. Because when children are sitting alone, they can speak freely if you combine them with the adults. But it creates a good platform of a good governance, and the whole process, as I said, if the plan of action are well monitored and implemented, is where we can say that there is an improved of social services. But also create a very good relationship between the users, providers, and government. And our approach is well integrated in our program. We have sponsorship projects and the grant project. So today, Mwivano will share about CVA experience from grants, but also Pastor Molel will share CVA experience on sponsorship project. Why advocacy? Why are you speaking about advocacy on nutrition, specifically for children under 5? This is just a small list. I know that we have many, but as Macalius said, that there is a harmful traditional practice, especially when you are looking on the types of food. Who is supposed to eat what? If you refer on Macalius' list, you can understand that we have a lot to do in our community so that we can change their mindset. I and them can change their mindset toward the type of food they're supposed to eat, either for children or expecting mothers. But also, community have, I can't say they don't have inadequate, low awareness on their rights and responsibility. People are not aware on what they're supposed to do. They are not aware on their rights. And because they are not aware of their rights, it will be very difficult for them to demand something. So if we raise the awareness, in the community, it will help a person or a citizen to have a confidence on where to start doing something and to speak about something. But on nutrition, we have some many issues. We have been speaking about exclusive breastfeeding. It's still a challenge in our community. We need a lot of voice. We need a lot of training and the awareness to the community so that the women can understand and can start ensure that there is exclusive breastfeeding. But at least a woman, at least a child should at least 2 years breastfeeding. But we still have a challenge in our community, in urban and in rural area. That's why we need to do advocacy on that. And complementary food after 6 months. It's a challenge to many families to know that what type of food are they supposed to give for their children, but the frequency also of eating and the nutrient is the nutrient behind the food. But the vaccination, according to age appropriate, but we are talking about the right of food to the children. We are talking about right of food, but it's still a challenge in our community. Food is not accessible, and we still have a challenge. Sometimes they always produce for the household, but after a few months, they always sell the food. And then they suffer again. So we need to talk about the food security at the household level. And protection of diseases. When you're talking about protection, we are talking about prevention from the disease, but the way we respond if the disease come up to the children is still a challenge. But from yesterday, I think from day one, we were talking about low awareness of male involvement, especially in nutrition and in health. So we'll hear from Ivano the experience from Enrich Project on what they have done on male involvement. And from day one, we have seen that we need to include men and women in nutrition. And I was trying to refer on Amaranth, grain, value chain. The way we need to include both men and women. Who is involved in production? Who is involved in distribution and consumption? At the end of the day, who will hold that money and who will make decision of that money? I don't know the experience of the community, but we need to analyze at the end of the day, Amaranth grain is for who in Tanzania? We know that coffee is for men. Amaranth grain is for who? And how are we going to involve both men and women? We still have a low awareness on home gardening and a low awareness of uptake of micronutrient supplements to mothers and children. Another challenge, we know that we have a nutritional focal person at the district level, and we have many stakeholders working at the district, at the ward, and at the village, but coordination of nutritional intervention from the regional, district, and ward and village is still a challenge. But we heard from Grace from government. She was talking about increase of budget on nutrition, but in reality, we still have a challenge on that. So we need to advocate so that we can have adequate budget allocated for nutrition. Some findings and results through CVA, specifically for Enrich Project, we have managed to reach 50 villages and train 200 community facilitators on CVA methodology. And those 200 community facilitators managed to reach 1,500 community members who have been trained on health and nutrition policies. And we can say that there is an increased responsibility and responsiveness of power holders and duty bearers to service users on nutrition. And somehow, in Enrich, because males had been involved in nutrition intervention, there is somehow increase of male involvement, but we are not yet there. We still need to do something on that. And through CVA approach, citizens are open to voice out on nutritional issues. As I say that, during the community gathering, different groups are organized so that they can speak out and share the issues affecting them on nutrition. So we always create a platform for different people to speak openly on issues pertaining to nutrition. And also because we have been raising awareness, you remember the component of citizen empowerment. We need to educate the community on the importance of home gardening and eating fruits, so we can see some changes on that. But because CVA, we are focusing much in raising awareness for community to understand the policies related to health and nutrition, we can say that in our community, especially for example, because the case study was in REACH project, they are more aware on what is the monetary standard stipulated on health and nutrition. And also, we know that we can't separate the nutrition and the school feeding program. We have some schools that have been introducing the school feeding program and introduction of orange-fleshed sweet potatoes. We have one challenge, as we say, that is the mindset. It's just a mindset issue. In some areas, when we are promoting male involvement on nutrition, sometimes they are labeled as stupid or dominated by their fellow women. It's a mindset, and sometimes even you who are sitting here, you might have that mindset. So slowly, slowly, we'll change. What are the challenges when you're talking about advocacy on nutrition, specifically for children under 5? We still have a shortage of healthcare providers, as we know that a nutritional person is based at the district level. At the district level, have many wards, many villages and streets. For that one person to save the whole district, to provide a technical support for the whole district is a challenge. So as a stakeholders working here, we need to work together and advocate for more nutritional specialists at the ward, district, and yes, who can provide technical guidance at the ward and district. But we have been talking about the poverty, the low income of the family. We know that on nutrition, at the family level, sometimes they need to buy other foods. They can't have everything at the family level. You can have this one, but you are missing, and you need to buy another thing. But we still have a challenge of low income. You know, the family don't have money to buy other items related to nutrition. But the challenge of climate change, they can cultivate, but the drought can affect their production. But another challenge is inadequate food insecurity at the family level. So when you are talking about nutrition, let us also address the challenge of food insecurity. But during the CVA plan of action and prioritization, there is a conflict between government priority and community priority. Because the government can come up with this plan and priority, but the community, they have their own priority. So in addressing the specific issue, because these priorities are conflicting, is a challenge. The community priority can delay and the government priority can take lead. Lesson learned as we do CVA and the advocacy to the community, we are seeing that citizens are voiceless when they don't have enough information. If you train them and raise the awareness on their role and responsibility, and they know where to click the button, it will be easy for them to stand for themselves. But also, community can demand for improved services if they have been sensitized and made aware of their rights. I have seen that. If the people are empowered well and practice, they can manage their own development. We heard from the previous presentation on mindset transformation. If people are empowered, they can stand for themselves and manage their own development. Government can improve social services in place where people show demand. If people are relaxed, the government will relax. If people are speaking out, the government will be accountable. Some recommendation, just few. I know that we have many. The government, as stakeholders working on nutrition, we need to lobby and speak out so that the government can increase budget on nutrition interventions in the areas where we are working with for the whole country. But also, it's not the issue of increasing budget, but also to monitor the budget which is allocated is specific for nutrition. But at the district level, if even the citizen to be aware how many is allocated for nutrition so that they can monitor that budget allocation. But also we need to work together so that the number of health providers can be increased so that they can manage nutritional problems in the marginalized community. Another one, stakeholders, we need to work together with one voice to address the community issues and needs related to nutrition. And we believe that citizen-led advocacy can improve health and nutrition system and services in our community. Because we know that there are international organization and local organization, and most of the time if NGOs is speaking in front, the government, they always say that there is a donor behind. There is a money behind. So we need to empower the citizens so that they can speak and ensure that they are upfront to speak about specific issues related to health and nutrition. And while we are implementing CVA, we need to select some few areas. We know that the challenges differ in one village and another. So let us start with the villages with a lot of challenges and concentrate on that areas, empower the community, explain to them about their right and responsibility, what are the government policies saying about specific issues, so that the three phases I spoke about, the community can start from the beginning to the end, and at the end of the day, they will celebrate, and the result will be seen in improving social services related to nutrition and health.
Thank you. As Esther said, my name is Muivano. I'm working with World Vision in enhancing nutritional service to improve maternal and child health. It's a project that operates in 2 regions of Tanzania, that is Shinyanga and Singida. And we are operating in 5 districts from those 2 regions. And few among the challenges that were encountered in operating in those regions, as per the gender perspective, was the first one was lack of women decision-making power that hinders women to utilize resources as per the recommendation made while visiting antenatal services. The second challenge was poor access and control of resources. And the third one was low male involvement. Well, there's a lot of improvement that has been done by the Tanzania government through health facility. But then what happened is that women are really being escorted by men, but men are not involved in counseling session being conducted by healthcare providers. And sometimes they are being escorted by the men, but they are not biological father of the specific pregnancy. So which makes the barrier, gaps between the education being provided reaching to the target beneficiary. And also, as Esther said, that we have our own advocacy approach called Citizen Voice and Action. Community are part and parcel of improving health system and increasing coverage of the health services. But then, due to these challenges, we also noted that the coverage, it's not as what was intended. And that has been contributed much by gender gaps. So from that, we adopted the approach. It's a global fatherhood campaign called Men Care, which aims to promote male involvement as equitable, responsive, and non-violent fathers and caregivers in order to promote children, women, and men's well-being and gender equality. So we have 2 facilitators from each villages that we are operating, in total 50 villages. So we are having, we have 100 of facilitators who are men, and they go back and initiate many groups with the limited of 20 to 30 main groups per group, and they should undergo 25 sessions until they graduated from the groups. And those sessions are different from one another, but then they are starting educating themselves on gender equality, caring of the baby, violent issues, and there are some sessions that they are calling healthcare providers, discussing on health issues, and in a particular section, reproductive issues, family planning be part of it, and they are also discussing about the fatherhood, parenting, positive parenting of the children. And from that groups, we noted a lot of achievement. One being increasing of a proper men involvement in maternal, newborn, and child health from 50 to 80%. That was a very biggest notable achievement. And to our surprise, in this World Breastfeeding Week, they requested from World Vision and Reach Project that they need to increase awareness of breastfeeding. And they want to be capacitated so that they can move throughout the days, the campaign days, but they will continue even after the campaign, and they are moving to the hamlet level to educate women and men on early initiation of breast milk, exclusive breast milk, and continue breast milk at least up to 2 years. That was another biggest achievement that we obtained from Enrich. But also we noted that men now are very responsive on addressing household issues, nutritional issues, in particular making sure that the household has availability of nutrient-dense food. That is something that we also noted. And they are also recommending the uptake of micronutrient supplement to the pregnant mothers, and also micronutrient powder to the children. So this is the achievement obtained through this global men campaign. Thank you very much.
Can we take questions? Just to alert you that lunch will be about 45 minutes late, but that still gives us an hour for lunch, which means don't be discouraged. Did you hear me? Don't be what? Discouraged. We're going to take adequate time for questions, and we're also going to do the poster session before we go to lunch. And you can all partake in the poster session, at least to have an introduction to the posters. And then we can spread them out and you can be free to roam until we're called for lunch. Is that okay? Okay, please stand up. You look very... Would you write your name in the air with your right hand? Now write it with your left hand, please. Now write it with your nose. Now would you write it with your umbilical cord? Please. It's your chance. Let me get the question started and then. No, thank you. You may be seated. We're going to take questions for. Let's see, are there any comments? Raise your hands.
Okay, thank you very much for a very good presentation, and I also thank you for your contribution on nutrition at large. But was wondering on your challenges on coordination on nutrition intervention at local level. You said something about the budget. And I know it's actually a challenge on our side as a government. We actually mostly get budget that is under, or what it's less than we expected. Or sometimes there is an issue of late disbursement of the funds. Now, I didn't get to understand how does that affect you? Do you have any any example on how this affects you as World Vision on implementation of these activities? Okay. My name is Doris Munisi.
Thank you so much. My name is James Mutiaba from Uganda. You talked about the advocacy you do, that you engage in policy change, education. But in most cases, when you are doing advocacy, you look at engaging the government if there is inadequate service delivery to see that it is being met. But you say that you don't so much engage in trying to talk about government to see that government brings in services. How do you balance that to see that you don't engage, you don't put government on the task? Because when you come and you say that a dispensary is supposed to have this, but when available, it's like you are, that it has to do something. But in the eyes of government, it's like you are attacking them. So how would you balance to say that you do that and yet you bring? Thank you so much.
No other questions? Comments?
Okay. Thank you very much. I'll start responding the question from the lady. It was about the issue of budgeting. Well, World Vision, it's development partners, other partners that we have short projects such as Enrich that it's operating within 4 years. And we are contributing, rolling out, implementing as per the National Nutrition Multi-Sector Action Plan. So most of our activity is aligning with multi-sectoral nutritional action plan. As I said earlier, our project is operating in a very few sites. We are operating in 2 districts of Singida, giving example of Singida, and in a few villages. And there's a number of villages that they don't have any implementing partner for nutrition, and they are lacking those kind of support. So having said that, we are seeing that we have a shortage. If World Vision could do other part and other partners and government supporting other part, that could widen our intervention and reaching number of people. So we are affecting on that kind of issues, which it's overloading the area that we are supporting 100%, such as the area that we are supporting micronutrient supplement. So we see the nearby communities coming to the area that micronutrient powder are being supported. We are yet to provide, but there's project that was supporting those kind of micronutrient powders, which they have more than what they expect, the population. And again, our project, we are supporting also distribution of the equipments, and we support height boards, weighing machine, and MUAC tapes, but the nearby health facility does not have, even including the health centers, which is a referral point, and hospitals. But then imagine if the budget it's sufficient, then the government could take other part and supporting that, and also other development partners. So we are really not affecting, but our wish is to reach everyone in the area that we are operating. So that it's the how World Vision is affecting.
I can respond to the question which was asked on how we are balancing our advocacy approach. As I said before, our advocacy approach is more of dialogue, persuasion, and lobbying, and working also with other like-minded organizations. At the community level, through CVA approach, we work with the CVA team, are working with the service users, providers, and government to identify the issues, sitting together on how to solve that issues and come up with a plan of action. We don't encourage to point fingers to the government without coming up with a solution, because we know that that is an activism approach. But if we sit together, we know that there is a specific issue affecting community, either on nutrition or on health, sitting together with the service user, service providers and the government, because on that meeting you'll find the MPs, you'll find the councillors, you'll find the technical people from the district, and prepare a specific plan of action on how to solve that issue. We know that at the community level, as a citizen, they have something to contribute to address the issue. But other issues are not within their mandate. For example, when we are talking about increase of human resource, is not within the mandate of the citizen. It will be easy for the government to know that in another financial year, we need to budget for this and ensure that we increase the human resource. There is a specific building they need to support. The community can say that we can contribute our local material, but other things cannot be contributed by the community. So our approach is more of dialogue, so that the government can see what they're supposed to contribute, but also the community can contribute something to address the issues. Together, there is that collective ownership and sustainability and empowerment. Yeah.
Hello. Thank you for this opportunity. I want to ask, is that a question or a comment? I am Winston Mombek. I work with Farm Concern International, and my organization has benefited working with the World Vision for several years. So we appreciate for the work that you do. Now, back to my question or comment. There is the word puts emphasis on helping or supporting women, and which is great. I am a father of 2 daughters and one boy. I would like at one point to see my daughter having a great family, being supported by a husband. But one concern which I'm having, especially the people who are supporting these groups, and what effort are they putting on helping men? You see, now you are talking about men at their old age. The girls or women are being supported from when they are still at that age when they are growing. But your approach to men when they are mature and their level of changing is a bit not that flexible. Is it not now the time to start investing in young boys so that at the end they will be able to become responsible men and fathers? Thank you.
Thank you very much. As World Vision, we have specific intervention, and we are working with parents and children. And we have different models. One model is called Celebrating Family, whereby parents, we are working with the parent and faith leaders. They sit down and reflecting on their childhood and what they have been done for them and what they want to do for their children. But also we have other specific model, I think for children, is called Children Nurture. So we have different interventions so that we can reach different groups. We are not working with the adult alone, but specific intervention for children, because we know that the way we are behaving now, we were affected when we were young. The way you are responding now is not because of you, it's what your parent imposed in your life. So there is a lot of factors which shaped our thinking, our attitude and behavior. And we know that that's why we are talking now about mindset. And the mindset change is not for adults alone, even for children, from the childhood and the way they need to interact with their fellow children and their parents. I can add a little bit. In World Vision, we have also we are working with the government to formulate and to train the junior councils at the village level up to the ward level. And on those councils, as World Vision, we are working with the government, specific social welfare, to train them on different areas and child rights issues. And from there, we know that they can grow well spiritually, physically, and mentally.
And also in a module that is being used by our grants, enrich grants, main care module, positive parenting is among the session that the men undergo. And it's a decision, it's a room that gives men to discuss what is the effect of positive parenting and what is the effect of positive and negative effects of negative parenting. And then they make their own conclusion what parenting they should do for their own kids.
I don't know how many of you have ever worked for World Vision, but it being one of the biggest NGOs in the world, they're very vulnerable to attack. Not so? Criticism. And I think we really celebrate this event that you've come together with us to present the best practices. And when I consider what I've done to improve mother and child health compared to what you're doing, I see how small what I've done. So I can say in a new way, I really celebrate the work that you're doing. And let's celebrate it with really a loud applause for the two presentations this morning from World Vision, doing very excellent work. As our colleague from Uganda said, wow. Thank you very much for this very good presentation and your work. And you'll still be attacked. The problem of being big is you're very easy to target. But don't be discouraged. Thank you very much.